Thank you for the introduction. Dr. Leah Tedessa couldn't be here, and she sends her regards and apologies. This is an important topic for her, and she made sure that I go represent for this. So I'm delivering this statement on her behalf. And this week I've been the bearer of the bad news, saying, hey, I'm not Dr. Leah, but I'll do this. So I'm trying my best, so I'll continue with that. Excellencies, distinguished delegates and guests, all protocols observed. In Ethiopia, an estimated 7.8 million people are infected with the hepatitis virus. 1,000 people per month are estimated to develop hepatocellular carcinoma. And every 35 minutes, someone dies of HPV or HCV infection, with 75% of this death is attributed to HPV. Without the widespread use of HPV first dose vaccination, an estimated 17,800 infants will develop chronic HPV infections per year in Ethiopia. The Ethiopian Federal Ministry of Health has reached several milestones in the national virus hepatitis program, and this includes development and recent updates on the National Hepatitis Treatment Guideline and the National Strategic Plan. Since 2019, the viral hepatitis program is integrated with the HIV program. Ethiopia has started inclusion of the viral hepatitis B vaccinations at 6 weeks since 2007, and as of 2021, the coverage for the 3 doses of hepatitis B vaccine was over 93%. HPV burst dose pilot program was also started in 2021. We have started with 4 regions in Ethiopia at different levels of health institutions, starting from the very bottom at the health post all the way to the hospital level and tertiary level centers. The results have shown that the burst dose vaccination coverage in the pilot sites were more than the planned national target of 70% in all regions. Overall, 45% of the vaccinations were provided for home delivery, and 97% of those were born in health facilities. Finally, I would like to say that Ethiopia has already undergone effective pilot implementation, and the study has confirmed that it is feasible to expand it across the nations. Once we get the Gavi support, Ethiopia is ready to scale up the hepatitis B burst dose program across the country. Ethiopia is happy to join the UN group of friends to work together for hepatitis elimination goals, and appreciates the efforts of Professor John Ward and Professor Harvey Alter. Thank you very much.